Chestnut Health Systems has developed an intervention called Recovery Management Checkups and Support, or RMCS. This video will provide a general introduction and overview of the RMCS model. Treatment for substance use disorders can reduce alcohol and other drug use and increase rates of abstinence. However, gains realized during the course of treatment often diminish over time, especially during the first 90 days after discharge. These results have led researchers and practitioners to shift from focusing solely on acute episodes of care to viewing addiction as an illness similar to others such as diabetes, asthma, and heart disease, all of which have the potential for recurring cycles of remission and relapse. This cycle indicates the need for longer-term recovery support services after treatment to prevent or minimize relapse and promote improvements in substance use and overall functioning. Unfortunately, efforts to provide recovery support services are often unsuccessful. A large percentage of individuals leave treatment early and receive no further care until a crisis prompts them to re-engage. Formal continuing care services provided by treatment programs are typically offered only to those who complete an acute episode of treatment. Clients are expected to make the effort to connect with services and attend clinic-based sessions. If clients follow through with this recommendation, their substance use and related outcomes often continue to improve. Yet a significant number of clients never begin continuing care or drop out early. Attendance at mutual support groups is another common recommendation made by treatment programs that is associated with positive outcomes, but clients often stop going after a relatively short period of time. Geographical distance, lack of transportation, inadequate public transportation systems, and lack of childcare can also impact clients' ability to access traditional sources of recovery support. Therefore, it is important to explore other ways of providing recovery support services that overcome these obstacles and put the responsibility on the recovery support worker or specialist to reach out to clients rather than wait for clients to come to them. Recovery Management Checkups is an evidence-based recovery monitoring model developed by Drs. Chris Scott and Michael Dennis that has been found effective in randomized trials. It is based on the idea that ongoing monitoring through regular proactive checkups and early reintervention will facilitate early detection of relapse, reduce time to treatment reentry, and improve long-term outcomes. The purpose of Recovery Management Checkups and Support, RMCS, is to provide monitoring, ongoing assessment, recovery support, and early reintervention for individuals with substance use disorders after discharge from an acute episode of treatment, regardless of whether or not the treatment was completed. RMCS is delivered over a 6-month period and is initiated within 1 week of discharge from an acute treatment episode. For the first 3 months post-discharge, recovery support sessions are scheduled weekly. Over the subsequent 3 months, frequency is adjusted in response to and in support of each client's needs and functioning. Recovery support sessions occur at times convenient to clients and last 15 to 20 minutes in length or longer according to clients' needs. Support sessions are conversational in tone and take place in person in the community or at the office, over the phone, or by text. Sessions with a family member about the individual can be offered on the same schedule. Support sessions are delivered by recovery support workers who cover the following procedures: increasing pro-social and pro-recovery behavior, divided into 2 procedures, increasing pro-recovery peers and increasing pro-recovery activities, setting positive and brief goals, assigning client-directed homework to achieve goals, assessing substance use and related problems, discussing any relapse triggers that were experienced, and exploring any upcoming situations that would be high risk for relapse. Clients receive praise for any efforts at engaging in pro-recovery activities with pro-recovery people and identify ways to increase these behaviors while problem-solving barriers to do so. RMCS protocol allows recovery support workers to discuss topics that are most relevant to a client during a given session, rather than trying to artificially force the discussion into a predetermined format. If the brief assessment that takes place every session indicates that the client could benefit from re-entry into substance use treatment or other services, The recovery support worker initiates assertive linkage procedures. The goal of assertive linkage is to assure that clients actually access the needed service, and these procedures include identifying and addressing barriers to treatment reentry, making an appointment with a treatment program for an assessment during a recovery support session, bringing the client to the appointment, monitoring attendance at recommended treatment, maintaining contact with the client during treatment, and collaborating with treatment staff to identify and intervene with clients who may drop out of treatment early. Training takes place over 1.5 days and consists of didactic presentations, interactive exercises, role-playing, and listening to examples of recovery support sessions. Recovery support workers are asked to audio record some of their sessions and upload them to a secure website for fidelity monitoring and feedback. An expert rater listens to recordings and provides written feedback to the recovery support worker through the system. Written feedback is provided to each recovery support worker weekly for the first month after training and monthly thereafter. Monthly coaching calls are also provided. If you have any questions about RMCS, please contact me, Laura Passetti, at the email or phone number listed. We can also provide you with a list of peer-reviewed journal articles for further reading.